ZEISS forum will fill the gap between the general ophthalmologist and the glaucoma specialist. If they have appropriate tools to confirm them that this patient has stable glaucoma condition, they don't need to refer those patients to glaucoma specialist. My name is Manchima Makornwattana. I'm the Associate Professor of Ophthalmology at Thammasat University, Faculty of Medicine, Thailand, specialist in glaucoma and cataract surgery. I've been practicing in glaucoma for more than 20 years. During those 20 years, my problem of taking care of glaucoma mainly is not from the difficulties of glaucoma itself, but dealing with the patients who are having or who are about to have glaucoma is the most challenging thing. Glaucoma in Asia, they have more trouble in angle closure and normal tension glaucoma. The angle closure glaucoma is more challenging compared to open angle because angle closure has less symptoms, lowering of the intraocular pressure. So when you detect the patients by intraocular pressure, you may have misdiagnosis. And also, they have a chance to have acute glaucoma attack, which leads them to the blindness more than open angle glaucoma. And that makes the angle closure more challenging. Glaucoma treatment is not just only lowering the eye pressure, but it is to concern patients' feeling, patients' quality of life and quality of vision. Because when patients has been diagnosed with glaucoma, they have a psychiatric problem. Nobody would like to get blind. So the human touch or relationship between doctors and patients are really important and make better quality of care. Glaucoma is a long life disease, and patients at first, there's no symptoms at all. So if the patient doesn't know or doesn't concern their problem at earlier stage, they're gonna have a problem which is a permanent damage and irreversible. In the other way around, the treatment that we offer changed their life in terms of more suffering. Instead of having a happier life, they have to use the eye drops maybe 3-4 times a day. You have to see the doctor regularly, at least like once a year or every 6 months, without they knowing what we are doing. That's gonna cause a long-term problem because they definitely will stop the treatment. So if you need the compliance of those patients, you need to educate them. If you have the forum, you're gonna see the document at the first that you saw this patient until today. With the long-term follow-up and long-term conclusion of all the data that we have, we're gonna get the message that is more precise, more reliable, and trustable, and also understandable to the patient. You can tell the patients that, okay, I see the progression, you do need the glaucoma surgery, you show the graph, the trend, and the decreasing of the retinal nerve fiber layer thickness. And this is really important for us to make a next step for the patients to still continue their treatment with confidence that they're gonna get stable vision, no progression of glaucoma, or make the good decision that they have to have the surgery, which is a lot easier, and save lots of time. During the time they're taking care of that patient, they can have new things happen in life, right? Such as the cataract comes up. So when we do surgery for the cataract, and if that patient has glaucoma, you may have to add on the glaucoma surgery. If you're gonna have the glaucoma treatment with the cataract surgery, the diagnosis of glaucoma must be precise, especially in angle closure. The cataract surgery will affect the eye pressure and glaucoma care, especially in angle closure, quite a lot. You have to discuss with your patient what do you expect after the surgery. If the patient has severe glaucoma, we do the cataract surgery. The cataract surgery definitely will improve their vision, but it will not improve their visual field. So patients will complain a lot that they get better vision definitely, but it's not as good as they expected because they have some cloudy effect at the superior part of their vision. Before the surgery, if you use the visual field to explain them to understand what they would expect after the surgery, it will have a lot less trouble or complaint after the surgery with that patient. If you have good diagnosis of glaucoma, such as this patient has angle closure glaucoma, PAS, or peripheral anterior, the decision of cataract surgery plus the glaucoma surgery will make better outcome of that patient. Our first patient is 85 years old male. He is the father of our radiologist in our hospital. He came to see me 15 years ago. He has been diagnosed with open angle glaucoma for more than 20 years with the advanced visual field loss. At first that I saw him, he has severe glaucoma with the advanced visual field loss and with multiple treatments. He was using lots of eye drops with the borderline control of the intraocular pressure. With the thorough eye ocular examination, I found out that this condition is not open angle, it's an angle closure. So I confirmed him that he has angle closure, not open angle glaucoma, with the cataract. After many visits, he finally decided to go for the cataract surgery. No glaucoma surgery yet, but I do confirm him that the angle status is quite tight, and if we do just the cataract surgery, only removing the natural lens, the angle should be reopened and the eye pressure should be better controlled. After the surgery, it turns out the eye pressure a lot lower. He has no need for any eye drops at all, and the eye pressure is around low teen, which is quite happy number. But sometimes, during this 10-15 years, every single time that he followed up, sometimes he didn't see me. Some doctors saw his optic nerve, saw his visual field, which is very advanced. They won't trust that just this condition itself, without any treatment, will maintain the glaucoma condition of this patient to make it stable. So they always add on some eye drops. He will get back to me and would like me to confirm how is his glaucoma condition. Does he need the medicine? With the forum that we have the document that is strong enough to confirm doctors to maintain whatever they are doing and also make believe to the patients that their condition will not be changed. With this condition, if there is no treatment, we generally follow up patients a lot more frequent to see is there any change or not. But with the long-term back tracing, we have more confidence to see patients less frequent, which is going to improve their quality of life, and also we have time to see other patients and more quality of time to talk with the patients. So all these documents are really support us in terms of practice. My second patient, she's the 55 years old female. She's with me for many years because her parents are my patients with the angle closure glaucoma. She's really high educated. She knows her parents' glaucoma condition quite well, and she concerns and she also realized that this glaucoma condition runs in family. We have the ocular examination regularly, and at some point we saw the eye pressure that is start to raise in her eyes, and her condition is angle closure but not yet glaucoma. After the examination, it shows that her lens is getting larger, bigger, and indented the angle and make the eye pressure rising. So we discussed with her, with the age of 55 for the cataract surgery is too early. She definitely doesn't want the surgery. We try the medication first to lowering the eye pressure without having the cataract surgery. She has to use the eye drop every day. She had many side effects from the eye drop itself. She tried her best to comply with those, but at some point she can't accomplish those. So finally, we decided to go for the cataract surgery. She doesn't need glaucoma surgery. However, we do believe that with the cataract surgery only, it will relieve the angle, it will reopen the angle, make the eye pressure lower without doing anything more, and then we evaluate her again, how's the eye pressure response to the surgery. We go through lots of tests of her optic nerve appearance, of the scanning of the nerve fiber layer thickness, her visual field. Everything confirms us that everything's are stable and normal for a long period of time. The test result that we all have show her the trend. That's why we gain the trust from her. Until right now, her eye pressure are well controlled in both, and her condition of the ocular problem still stable without glaucoma damage. And she's very happy with the result.
อาจารย์ให้เวลานะคะในการตอบคำถามแล้วก็อาจารย์ทำให้เรามั่นใจว่าการดำเนินไปของโรคจะเป็นยังไงแล้วก็แนวทางในการรักษาจะเป็นยังไงค่ะเพราะฉะนั้นเราจะมีความมั่นใจเพราะว่าเราสามารถที่จะสื่อสารกับอาจารย์แล้วก็สามารถที่จะรู้ว่าขณะนี้โรคเราดำเนินไปถึงตรงไหนแล้วก็
There are many patients in the community that have glaucoma. There is no need that every patient has to see glaucoma specialist because general ophthalmologists also could be able to take care of glaucoma patients, especially in suspected glaucoma, in stable glaucoma. General ophthalmologists, if they have a good tools or appropriate tools, to diagnose or confirm them that this patient has stable glaucoma condition or no progression of glaucoma problem or suspected glaucoma which is not turning to glaucoma yet, they don't need to refer those patients to glaucoma specialist. ZEISS forum that we have in the market will fill the gap between the general ophthalmologist and the glaucoma specialist. You're going to see better care for those patients who are still in the care of general ophthalmologists, which is they have trust already and also very easy to access compared to glaucoma specialists.